This is another presentation by My Weight World.
Gastric bypass surgery and nutrition, part 2, key points. Making the decision to have weight loss surgery is a life-changing step. There are many issues to consider, and the results can make an amazing difference in your health. But like anything worthwhile, this takes a great deal of commitment and education as well as hard work. The goal of this presentation is to provide you with key points that you need to know to minimize the risks of complications from your surgery and to ensure the best possible outcome, good health and weight loss. This presentation will provide you with additional information on nutrition and surgery. Following the presentation, Gastric Bypass Surgery, Nutritional Preparation Part 1. We will go over these background facts, why these recommendations are critical, and provide ideas for staying with the diet and nutrition guidelines. The first key point to remember after having gastric bypass surgery is size matters. Be sure to keep all of your meals to no more than 1/2 cup total volume. Use a measuring cup and carry one with you so you are sure about portions when eating out. Eating a larger portion can damage your new stomach pouch, cause pain and other distress, and inhibit weight loss. Key point number 2. Take vitamins as prescribed every day. Because you absorb vitamins and minerals differently after surgery, daily supplementation is required for the rest of your life. Failure to adhere to supplementation guidelines may result in nutrition deficiency diseases such as osteoporosis, anemia, and other health problems. Continuing on with key point number 2, supplementation may include a multivitamin with minerals in chewable or liquid forms, taken with food to help absorption. This must contain 100% of the RDA for iron, folic acid, and thiamine. Calcium supplementation is also important for your bones as well as other important functions in your body. 1,500 milligrams of chewable or liquid calcium citrate per day should be taken. Read labels. Take a maximum of 600 milligrams at one time and make sure the supplement has at least 400 IUs of vitamin D and also contains magnesium. Do not use calcium carbonate since this is not well absorbed. Iron is a necessary supplement for women in their childbearing years or those with iron deficiency anemia. The recommended dose is 54 to 65 milligrams of elemental iron per day, along with iron from your vitamin and mineral supplement. For best absorption, take the iron on an empty stomach with a vitamin C containing sugar-free fluid. Vitamin B12 is also a critical supplement for gastric bypass surgery. This vitamin is important to supplement to prevent pernicious anemia and nervous system disorders. This vitamin can be taken either under the tongue, known as sublingually, or by injections once a month. B12 supplements are not swallowed because of the change in your stomach structure and functioning after surgery. Key point number 3. Plan for your new eating pattern of 6 small meals per day. Small meals are 1/2 cup each. Use measuring cups to become familiar with this portion size. Meal portion control is essential for avoiding stretching of your stomach pouch and to help promote weight loss. This shows an example of a full liquid 6 small meal diet menu for the first week after surgery. Notice the small portions specified and the need for time to sip fluids that are so important between your meals. Remember, this is a critical time to use your measuring cups. Once you are on your puree diet, be sure to limit food to 2 to 4 ounces per meal, maximum 1/2 cup servings. Remember, eat the protein first. Aim for 6 small meals per day and use protein supplements to help meet your needs. Sip liquids between meals and not with meals. Remember, you are retraining your stomach. Avoid extremes in spices or temperatures. Examples of pureed diet foods include sugar-free fluids and protein drinks, low-fat cream soups, hot-cooked cereal and mashed potatoes, blended or baby food vegetables, unsweetened applesauce and pureed fruits, puree and baby food meats, and fat-free or 1% milk, cottage cheese, yogurt, sugar-free pudding, and ice creams. Key point number 4. Fluid intake is essential to avoid dehydration after surgery. Because your stomach will be much smaller, be sure to sip instead of gulping. Your post-surgery fluid intake goal is 6 to 8 cups, or 48 to 64 ounces per day, or as your doctor advises. After surgery, it is typically recommended that you do not drink fluids with meals and wait at least 30 minutes after meals before consuming any fluids. In addition to the importance of fluid intake, is the importance of avoiding sugary fluids, which lead to the dumping syndrome. Sugary fluids include juices, even the no sugar added or natural juices, soda, fruit drinks, sweetened beverages, honey, pancake syrup, and some fluid milk or soy milk products that may have added sugar. As a reminder, the dumping syndrome may include symptoms such as stomach bloating, diarrhea, dizziness, nausea, vomiting, and sweating. These symptoms occur when the sugary fluids and possibly foods pass into the small intestine very quickly, drawing in extra water to the intestinal tract. Key point number 5. Know the signs of dehydration. Because fluid intake is so important, it is necessary that you know these signs and symptoms so that you can take action. These symptoms include dark-colored urine, it should be light like pale lemonade, dizziness, confusion, and white coating on your tongue. Avoid all carbonated, caffeinated, and sugary drinks, again to minimize the risk of dumping. And especially avoid alcohol. This is dehydrating, and you may be much more sensitive after surgery. And alcohol has a lot of calories, which inhibits weight loss. Key point number 6. Remember, after weight loss surgery, focus on protein and fluid intake as most important, as well as prescribed vitamin and mineral supplements. 1 ounce of protein-rich foods provides about 7 grams of dietary protein, but be sure to read labels. And protein powders and supplements are often very useful for meeting your needs, but quality counts. Look for whey protein isolate products. Key point number 7. Be sure to consult with a registered dietitian experienced in bariatric surgery before and afterwards, as well as for long-term follow-up. Attend bariatric support group meetings before and after surgery as well, and make sure to keep all appointments with your surgeon, other physicians, and healthcare providers to monitor your progress and overall health status, as well as to receive much-needed encouragement. In summary, weight loss surgery requires commitment to the mentioned key factors for the best outcomes. Learn as much as you can about your needs so you will be well prepared, especially those concerning portions, fluids, protein needs, and avoidance of the dumping syndrome. Pay close attention to the expert advice from your surgeon, dietitian, and other healthcare providers. And attend meetings and support groups for helpful ideas and insight to make adjustment to your new body as easy as possible. For an overview and global perspective of nutrition needs with gastric bypass surgery, please refer to Gastric Bypass Surgery, Nutritional Preparations, Part 1.
This has been another presentation by My Weight World.